Welcome to Teen Talk, hosted by yours truly, 334 Prevention Project Youth Council. Huge thank you to Scenic for recording today's show. Today's topic is misuse of prescription drugs.
We will be interviewing Brennen Bowen. Brennen graduated in 2009 from Wallace Community College with an Associate's in Applied Science Radiography. In 2017, he graduated from Troy University in Troy, Alabama, with a Bachelor's of Science in Business Administration and majored in Global Business Management. In 2020, he graduated from the University of Alabama at Birmingham with a Master's of Science in Health Administration. He puts all these years of schooling together to work locally as a Departmental Supervisor of Interventional Radiology, but will soon be transferring to Mizell Memorial Hospital as the Administrative Fellow.
Thank you for being here today. Our first question is, are your prescription drugs dangerous?
Thank you all for the warm welcome. In short, yes, if not taken correctly. Taking prescription drugs in a way that hasn't been recommended by a doctor can be more dangerous than people think. In fact, it's actually drug abuse. And it's illegal, very similar to taking street drugs. But prescription drugs are only safe for the people who have prescriptions for them. That's because a doctor has examined them and they have prescribed the correct dose of the medication for their particular medical condition. The doctor has also told them exactly how they should be taking that particular medication, including things to avoid while taking it. They are also very aware of the side effects, which, need to be taken care of very quickly and under the direct supervision of that doctor.
Is it safe to share your prescription drugs with someone else? Why or why not?
Actually, no. Sharing prescription drugs with family or friends, even when you intend to help them, is a dangerous misuse that could cause serious consequences. Taking a prescription drug that was not prescribed to you is still considered prescription drug misuse, and that can also change depending on who you are and what size you are and what ethnicity you are and what gender you are. It could have some unintended effects. First of all, it is illegal. Federal and state law prohibits sharing of prescription drugs that are controlled substances. That includes substances like opioids, stimulants, and benzos. Like, a lot of people take Xanax, but that is still a controlled substance. One of the other things about why not to share it is that, these drugs are different dosages. And based on the different instructions, they are kind of tailored to each individual. So even if a person has a prescription for the drug that you plan to share with them, and they may also be on that same drug, their doctor may have a different dose or a different medication schedule for that particular person. There are some serious side effects that can come along with sharing those medications. All medications have, different side effects which doctors take into consideration when they are prescribing them. Each individual has different results based on their needs and how they interact potentially badly with other medicines. Overall, when you take a medicine from someone else, you can't always confirm that it's safe or that it's really intended for them. You really need to be aware that some drugs that have been illegally pressed into pills can, it may look safe, but at the end of the day, you just don't know.
Is it possible to get addicted to prescription drugs?
Yes. Again, taking the medication the way that the physician prescribed um, is one of the ways that you can, stay away from getting addicted to opioids or other prescription medications. Misuse can turn into a physical dependence and that drug addiction that can cause a lot of problems down farther into your life. Now, it just depends on the person. Some people are more susceptible to addiction than others. It depends greatly on your life, your genetics. Some people are just more predisposition to be addicted to certain things. But at the end of the day, anyone can become addicted depending on how often they take. And, it could just be one time. You could take that opioid one time and, your body needs it from then on.
What can happen if prescription drugs are commonly abused or misused?
Well, misusing prescription opioids like Percocet or Oxycontin or one of those others has been linked to, other drug problems further down the line, which can include your own health and your legal standing. Part of what the national laws are there for is to try and break the cycle and the link between prescription painkillers and illicit street drugs. If you have a habit of misusing prescription drugs, the likelihood that someone will commit a crime or be a victim of a crime or have an accident is much higher when that person is abusing drugs. It doesn't matter which drug it is, whether it's prescription or illegal street drugs. They are all abuses that can lead down a rough life. But like all drug abuse, using prescription drugs for the wrong reasons can have serious risks and effects for that person's health.
Which prescription drugs are commonly misused or abused?
A few that I've mentioned earlier, it just depends. An increasing problem of prescription drug use often includes opioid painkillers, anti-anxiety medications, some stimulants, some sedatives. It just depends. Some of those opioids that are used to treat pain, for example, Oxycontin and Percocet, contain hydrocodone, which can also be a big driver of potential addiction. Certain anti-anxiety medications can also act as sedatives, such as Xanax, Valium, Ambien. I know probably some of our parents take Ambien to just go to sleep, so it's readily available for anyone in that household to potentially use and abuse. But certain stimulants, such as certain ADHD meds like Adderall, Ritalin. I took Ritalin growing up, and I did not know because I did have ADHD. It was prescribed to me. We had a physician's order, and I was closely monitored. But it just depends, again, on making sure that it's taken correctly and prescribed.
why do people choose to misuse prescription drugs?
Well, for some people who have never used drugs, it can sometimes be weird to just think, why would anyone ever consider to do something so dangerous and so foolish? It's good to be aware of the many different reasons that teens and adults might be tempted to use prescription drugs in an incorrect way. Keep in mind, like, the reasons are not always obvious. They're not always just to, quote, get high. It can be anything and everything from, being exposed to it at a certain time, having, peer pressure, having some self-medication, curiosity, mental health issues. The list goes on and on. Some people abuse prescription drugs because they think it will help them have fun. I know growing up, you would always watch TV shows where there'd be some big party and they would all be using drugs to kind of, fit in, have fun. But also, they're also used to sometimes lose weight, fit in, and even study more effectively. I know one of the big things when I was going through college that some people that I knew did was to take Adderall to study. Being able to use that drug to get ahead is it's something that people will want to try to try and win. But like I said, it doesn't always work out. A lot of teens are vulnerable to prescription drug abuse that, you wouldn't ever think that they would use, any other drugs like street drugs, like, heroin and all those other things. It's kind of because the illusion that prescription drugs are safer, that they can't hurt you, that they're developed by big companies, and that the people who, make them are highly trained medical professionals. But at the end, also experimenting with these prescription drugs and using them to get high is also at some time, just like I said earlier, acceptable to be quote unquote cool. The more often that people are exposed to a certain drug, they're more likely to use it. For example, if I know for a fact that there are a lot of healthcare employees that are around these drugs, we are more likely, because we are exposed to it all the time, we have a greater risk of misusing them, whether it's stealing it or diverting them from patients. So that's just something just to look out for.
What are some of the warning signs that someone is misusing prescription drugs?
Gauging whether someone is or is not abusing prescription drugs isn't just based on physical signs and red flags. There are also a lot of behavioral changes and warnings that can occur with prescription drug abuse. There can be, depression, anxiety, even some psychotic problems that can be attributed to prescription drug abuse. At first, someone starts using prescription drugs, the behavioral changes might be, very subtle. It can include, a lack of concentration, lack of focus, whether that's at school, work, or anywhere else. but also a lot of irritability. I know that we've all seen TV shows where, you see someone that is, high, and they're, over in the corner, shaking and, being angry. And that, over time is what happens. People get aggressive, and there's a noticeable display with their personality. That can lead to a lot of other unattended, outcomes, like damaged relationships with their friends, their family, their loved ones. But it can also kind of group them in with others, that can, create a new group of not so helpful friends. They say that if you kind of like running with the bad crowd, it's not going to help. Going back to depression may be a sign of prescription drug use that can lie, in secrecy. You don't always know what other people's problems are. It could also be some financial problems, or, at the end, people can do crazy things to try and obtain these drugs, stealing, and, that can lead to other things. Some of the other risk factors besides stealing and all of that is, they always try to attain that higher high, taking higher doses than prescribed. They have excess mood swings. Their sleep could be off. There are some people that won't sleep for days, and others that will sleep for days. None of that is healthy. They'll make poor decisions. In the medical area, we see a lot of people come into the ER because they ran out of their medications, or they are, quote, losing their prescriptions and need more. That's just some of the warning signs that we see here on the front lines.
As someone in the medical field, I'm sure you have seen cases of overdoses. Can you share an example of time you dealt with that situation and what you had to do?
This was probably about 6 years ago. A young teenage girl had come into the ER, and she had taken an entire bottle of Tylenol. And I know you wouldn't think, oh, it's just Tylenol, but she also drank multiple gallons of alcohol with that. The Tylenol alone, that huge bottle, was enough to hurt her liver. But along with the alcohol, made her blood extremely thin. The reason why she had done it, she tried to kill herself over a boy that had hurt her feelings. It happens a lot. Her family had bought a very large bottle of Tylenol from Sam's Club, and it was readily available for, her to use if she needed for like a headache or a joint pain or anything along those lines. But it was also available for her to misuse it. She had, due to her very thin blood, started bleeding from everywhere you could possibly think of. Bleeding from the mouth, from the nose, from the eyes, and other areas that we're not going to go into great detail about. And at that time, I was doing CAT scans. I had to go in there and, get her for a scan and to see, if there was any other bleeding internally than, the blood that was coming out. And I had to go in there and talk to her about, the scan that I was about to perform and, why was she here? And, you could tell she was embarrassed and upset. She didn't talk much. You could tell she was ashamed. She had been crying, and you can tell from her parents being around in the ER that they were extremely scared about what was going on. These things don't just affect you. It affects everyone around you. I overheard her parents talking to the doctor and the staff saying, she's such a good girl. We never would have thought this would have happened. But it did. But I had the opportunity about a month later to rescan her, just to see, what kind of damage had been there. Due to her liver failure, her skin was yellow. She told me about how, due to taking all that Tylenol, that she now needed a liver transplant. And that, since her liver was bad, her body kept accumulating waste, because that's what the liver does. It filters out your blood. But I don't know what happened to her from then on. I wish I did. I just hope she was able to get the medical attention that she needed. And, after that, she needed even some psychological help, because, drug abuse is not just, a act. It's a decision. And she made it. And it's going to affect her the rest of her life.
Well, thanks for sharing that. And if you know someone who is misusing or abusing prescriptions, what do you suggest that we do?
If you think that a family member or a close friend is abusing prescription drugs, please talk to someone that can help. Talk with a doctor, a counselor, a parent, someone that knows how to get some action taken. They can refer you to a drug treatment program that can help. There's also a national substance abuse and mental health service crisis line at 1-800-662-HELP, which is 4357. Talk to the person about your concerns so that they know that you are aware of the problem and that you're there to help. And be that person to help them along their journey back to sobriety. But be prepared for a lot of resistance, a lot of denial. This is something hard for people to get over. Many people with addiction must face, a lot of serious effects before they recognize that they have a problem and that they won't help. But then at the very end, make sure you stand beside that person as they work to move beyond that addiction and to hopefully a successful life.
Thank you again, Mr. Bauman and Scenic, for recording today's show. I also want the viewers to know that we have a prescription drop box inside the Dothan City Police Department. Please utilize it and discard expired, remaining, or unused prescription or over-the-counter drugs.
Also, we are recruiting for new members here in the Youth Council. If you're in 8th to 12th grade and live a drug-free lifestyle, we would love for you to come join us. Please join us.
Is there anything else you would like to share with us? Like any experiences or anything? Like just anything at the top of your mind?
Sure.
Or any?
I will kind of share a little bit more about what I've seen come coming through the emergency room. It's not just, peer pressure or, a boy or girl, going through and trying to help, or not help, but create a bad situation where, that person would have to go and, potentially go and abuse drugs and overdose. It's not just over the counter drugs. It's also prescription drugs. It's also alcohol. But also misusing some of that can also have a lot of unintended outcomes with your personal life and your future. I know that there have been a lot of, car wrecks, a lot of deaths due to someone who has, been high on prescription drugs, caused a lot of pain for people that they just didn't know. I would say one of the biggest things for teenagers these days is how available all of these drugs are. My generation kind of started with the opioid epidemic. So we have these medications everywhere. And you'll see it, especially around the holidays, Thanksgiving, Christmas, the New Year. There are a lot more overdoses around that time period because everyone's there. Families are coming in and they're bringing these drugs in. Whether, theirs is prescribed, but coming back and, people are getting their hands on them that they're not supposed to. So I would say this going forward, especially during the holiday season, please keep a keen eye out for some of these warning signs that we discussed today and try to be that helping hand.
Okay, thank you so much. And finally, be sure to check our podcast called FTI for Teens Information, where Just Youth Council members reflect on our Teen Talk episodes and share our personal thoughts on experience. You can follow us on social media at 334 Youth Council. Thank you for tuning in. Bye.
Bye.